I'm Dr. Mark Rosenberg, and I'm here to talk to you about testosterone replacement in males and females. Testosterone is an important hormone for both males and females. Many of the listeners out there think, well, only males have testosterone. Well, that's not the case. When females enter the perimenopausal stage, or even menopausal, not only do their estrogen and progesterone levels fall, but so do their testosterone levels. And associated with falling testosterone levels, as well as their other hormones, is decreased libido, decreased energy, decreased muscle mass, and fatigue. And we certainly see that in males as well. With males, as opposed to an abrupt falling off of testosterone that can occur over a few months, it's a gradual falling off of testosterone. And some people call this process andropause, which is a pausing or the gradual loss in testosterone production. And many of the males out there realize that as they age, once again, their libido goes down, their energy levels go down, and cognitively, their memory may not be as good as it used to be. They're not quite as sharp as they used to be. And their body habitus is changing. They're watching more fat deposit on the trunk with decreasing muscle mass. And once again, that's often a manifestation of decreased testosterone levels. So what can you do about it in both males and females? Now, what many of us have different options as far as getting testosterone replacement, and it should always be done by a doctor, and you should have levels followed carefully. Now, different ways to get testosterone, there's certainly injections. My preference on testosterone replacement is to use the bioidentical transdermal creams or gels. Now, the reason I prefer the bioidentical transdermal creams or gels is you can get gradually increasing levels as opposed to when you inject, when you get a huge bolus of testosterone, which shuts down your own natural production. So, in summary, I want everybody out there to realize that as you age and your hormone levels fall, specifically testosterone, you shouldn't just say, well, that I'm aging and there's nothing you can do about it. You can safely and carefully replace your testosterone levels. Now, especially for males, it's important that you know it's got to be followed by a doctor and that you should always have your PSA or prostate-specific antigen checked. And the reason is, any males out there that may have prostate cancer, there is a phase where the prostate cancer actually responds or gets stimulated in response to testosterone. Now, for some of you out there who either don't have access to a physician who can get some of these bioidentical testosterone creams or gels from a compounding pharmacy, or simply don't want to do that, but would rather just use natural supplements, there are many supplements that you can get on your own, either at a supplement store or on the internet, such as DHEA, which stands for dehydroepiandrosterone. DHEA is a good supplement specifically for females that will convert to testosterone. Now, there are other supplements such as Tribulus terrestris, horny goatweed, and something called Tongat Ali. There are many, many other supplements that have been found to mild to moderately boost testosterone levels. And so you can research that on your own. And once again, this is something that you can get without a doctor's prescription. And these won't cause any super high levels that would make us, worry and say, oh, you need to see a doctor, because they're only mildly stimulating. But they are available. And it's important for people to realize that boosting testosterone when it's low, of course, I'm not talking about getting to high levels, but boosting it to reasonable levels can have a great effect on the mind. And what I mean by that is there's a lot of depression associated with the aging process. And it's not necessarily just because of what's going on around you. It's not necessarily just situational. And what I mean by that is a fall in hormone levels is often associated with depression. So what we see many times in both males and females, when their testosterone levels are low, when we replace that testosterone, boosting it either through natural supplementation or through the bioidentical hormones, we often see the depression fading. What I'm saying is, sometimes just getting an antidepressant is putting a Band-Aid on it and not actually treating the cause, which is often testosterone depletion. So once again, if you're feeling that possibly your testosterone level is low, if you're feeling depressed, if you're feeling low energy levels, low libido, feel like you're losing your muscle mass and increasing fat, consider getting a natural supplement. If you want to go further and get bioidentical hormone replacement, get your doctor to measure your levels and consider getting bioidentical hormone replacement. It really can make some great changes in your life. This has been Dr. Mark Rosenberg talking about testosterone and testosterone replacement in